Did you see that? Did you see that? What? Did you see that? If this is you, you may have floaters. What are floaters? Well, I'm glad you asked. So, inside of our eyes filled with a gel-like substance called vitreous gel. So like if I were to push on my eye, see how that goes in? That's because that whole eye is filled with that gel-like substance called vitreous jelly. And as we age, and I know, but as we age, that jelly, pieces of it become hardened. And those hardened pieces float around in the rest of that jelly. And every time one of those hardened pieces floats across the visual axis, it causes a shadow, and it causes you to see that visual distortion. We may think a bug just flew by or something's crawling on the wall, and then you go to look and it's nothing there. That was a floater. Whenever you get a new onset symptom in your eye, you need to see your eye doctor right away. Because while most floaters are deemed to be just an occasional nuisance, a floater can be an indication of something more serious going on in the retina. So you definitely want to see your eye doctor, have a complete dilated exam. He'll look back there and he'll say, yep, you have floaters. The more age-related vitreous symptoms that I mentioned. And the doctor will encourage the patient to give it some time and allow the brain, which is very adaptable, to adapt to those vitreous changes. And then you won't really notice them as much, or those hard pieces may settle down to the bottom of that jelly, and then you won't notice the floaters that much. However, today's population is more demanding and have higher expectations for their quality of life and may not want to put up with those occasional nuisances. So, is there anything else that can be done for floaters? Well, there is a procedure called a vitrectomy. And what happens with the vitrectomy is parts of that jelly is removed with the intention of restoring that clear vision without those visual disturbances. Now, a vitrectomy has a higher risk level, and so many times physicians will think that the risk of the vitrectomy outweighs the clear vision for the patient. And like I said, we'll encourage them to try to adapt to the floaters. Now, in recent years, that risk level has been reduced in the vitrectomy procedure due to advanced technology, improved techniques, and if the patient has daily living activities impaired by those floaters, like if you're reading and the page is filled with, dots and it's causing you not to be able to read, or even if you're driving or looking at your cell phone and you see these little disturbances in your vision and it's, clearly bothering your daily activities, the doctor may be willing to pursue a vitrectomy for you because, your life is being impaired. You would, come in and sit with the doctor, have counseling, an examination, go over your visual history, maybe your family history. And if he, feels like it's, safe for you to have a vitrectomy, that can be done. Another reason physicians encourage patients to just give it some time and put up with it is because usually floaters, while you do have those visual disturbances, it doesn't really decrease your vision at all. Because it's not decreasing your vision, that maybe you can, give it some time for the brain to adapt, and they're not quick to recommend surgery. But like I said, today's patients, they want perfection pretty much whenever they can. If the doctor, deems it safe, regardless if the floaters are decreasing your vision, they're still bothering you, and everything else lines up, he very well may go ahead and recommend you for a vitrectomy. Now, a vitrectomy is where those pieces are removed from that gel. Oftentimes we'll give the patient that clear vision without the shadows anymore. But this particular video is not to discuss the vitrectomy procedure. This was just to tell you those disturbances are floaters, and to let you know what's going on inside your eye and why you're seeing those distortions. But if you are seeing those, go see your doctor to confirm that they are floaters and to make sure nothing's going on in the retina, and that they are the age, related occasional nuisances that most floaters are. And you can make a decision with your doctor if it's worth having surgery, or you are able to breathe a sigh of relief because you know what it is and you know what's happening in your eye, and you're fine now that you have that information. Because education, is very powerful in helping you to, get through any kind of occasional nuisance that you may be experiencing. So I hope this video was helpful, and I hope that you learned a little bit. Comment below if you or someone that you know may have, floaters, and also comment below if you would like me to do any other videos about eye-related symptoms, or anything else that you may be interested in learning. Also point out that check out my other video that I did on cataracts and what cataracts are and how those are treated, if you're interested, or if you know someone that may have been diagnosed with cataracts. I hope you enjoyed this, and I thank you for watching to the end. And if you are interested in these topics, subscribe to my channel, Small Doses of April, and I look forward to seeing you in the next video.